Good morning. Today I'm going to be talking about occupational science. So to begin, what is occupational science? Well, occupational science can be defined as the formal study of the things people do, such as making the bed, cooking a meal, or working at a job. Occupational science has two components. One component is the occupation. Now, this is the familiar things that people do every day, and is usually defined as similar to the way occupational therapists define it in their field work frame of reference. The second component is the science component. This deals with generating new knowledge and discovery in occupations. Occupational science was first developed in the 1980s at the University of California. So why do we have occupational therapy or occupational science? What does it do for us? Well, one aspect is that one reason we have that is that it argues for occupational therapy needing more research and knowledge incorporated into their practice. Now, this argues for the fact of maybe funding research or different areas of occupational therapy in the way they can research. Another reason we have occupational science is to answer questions about occupations and their effects on what happens when clients lose an occupation, the ability to perform an occupation, or the effects of occupation on wellness. An example I have is my grandpa. My grandpa, 2 years ago, at the age of 75, had to have a complete knee replacement. One of his big hobbies and one of his besides work, especially since he's retired now, is hunting. He hunts deer, he hunts duck, he hunts elk, bear, you name it, he'll hunt it. After his knee replacement and after the required therapy, he still was not able to really perform as well anymore in the woods and walking through thick forest when hunting deer. Now, this didn't just affect his ability to walk through the woods. It affected his emotions as well. He became bitter about it. I remember hunting with him, and every morning it just seemed like he was so negative about hunting because he was already sad about his inability to already know that he's not going to be able to perform the way he wants to when walking in the woods. And if he has to track down a deer and go fast through the woods, he's not going to be able to do that. So this is one example of where occupational science can maybe say, how is this really affecting, for instance, my grandpa? How is a knee replacement and losing some of that function in the knee going to affect him with his occupation of hunting, but how is it going to affect him maybe in different areas that we didn't think about before? Thank you so much for listening to my recap of helping me learn what occupational science is. Thank you.